I remember the first time I came to the Voice Center, I felt like I was a superstar, the way that I was treated. You have all these question marks in your head about what's wrong. Hopefully it's nothing. But I knew even if it was something, that I was in the right place with the right people.
Very often we have a singer who's concerned about coming to the Voice Center because they're afraid their voice will be changed as a result of what we do.
They quickly found that I had a polyp on my left vocal fold.
We don't want to change the way you sound. We want to make it easier for you to produce your sound.
The term professional voice at the Voice Center here applies to anyone who uses his or her voice to make their living.
We want to maximize your voice production for the least possible cost.
I noticed my voice was going through a lot of issues from a fatigue standpoint. It wouldn't take me long during performances to notice the fatigue set in much quicker than it normally had.
I think one of the major jobs that we have as people who do intervention for singers is to try to keep them out of surgery, because if they don't need to be cut on, we don't want them to be cut on.
My upper range mix and falsetto voices were being compromised. I originally thought it was something that would just go away with time, so I didn't address it right away.
Ideally, we're going to see voice professionals before the problem arises, because if you're relying on your voice to do what you need to do all day, every day, then it's a muscle like any other muscle. It's gonna have wear and tear.
We immediately scheduled a block of time, and I believe it was 30 days, to do a complete vocal rest.
The professional voice user uses their voice, the vocal fold muscles, excessively by necessity.
Paired up with the vocal rest, coming off that, I was able to get some wonderful, not only singing therapy, but speech therapy to help me, at that time, cope with the polyp, to find ways to minimize what irritated it.
The value of speaking voice therapy here at the Vanderbilt Voice Center for the professional voice user is that we can help you establish your voice in such a way that you can use it and depend on it on a daily basis.
I did feel like it was personally tailored for my needs and my singing style. I didn't feel like I was just sort of going through the motions that everybody else goes through.
The patient's goals and desires for what they want to achieve with their voice is what helps guide what techniques we're going to use and what strategies we give them to guide overall treatment.
We want you to sing in the style to which you're accustomed. If you come in as a country singer, we're going to apply concepts and exercises with you that will be appropriate for a country singer. If you sing jazz, we're going to do things that are appropriate for a jazz. If you happen to be a classical singer, we're going to work with you from a classical standpoint.
I really felt like the instruction and the feedback I got was very relevant to my lifestyle, the way I use my voice, and the singing genre that I'm involved in.
We use video stroboscopy to image the vocal folds and to have a clear idea of their function, and also to make an estimate about whether therapy is going to work for them. It allows us to see actually how the vocal folds are vibrating. And one thing that we like to know is if the edges of the vocal folds are scarred or not vibrating appropriately, because we have specific techniques we can use to help people regain full motion of that vocal fold.
To have a visual via the video strobe of what your voice looked like before the problem started, then we have a really good baseline to compare any voice change to after you've been on the road, after you have been giving newscasts, after you have been giving sermons and teaching and counseling. You'll have the baseline to say, okay, because of this behavior, we've had this much voice change. So preventative care is pretty important to us, and we try and encourage all of our voice professionals to do that so that we have that baseline.
Unfortunately, the vocal rest in my case did not remedy the situation, so I did have to go in for surgery. The whole day here during the surgery was a great experience. From the time we checked in until the time I was checked out, I was very excited to get through with that surgery and to start applying the tools I learned through both the singing and speech therapy. I immediately went into 2 weeks of vocal rest, followed by a gradual work back of the voice. It was a great program. to sort of work it back little by little.
After you've had surgery, we work to make the voice clearer for you. We work on the way that you take care of your voice. We work on how much water you're drinking. We work on the amount of tension that you use to produce your voice. And then we also work on the actual way that you produce voice. Making sure that you're using enough air when you talk, that you're allowing the voice to resonate in your nasal and oral cavities in such a way that you have a clear voice for your job that allows you to speak in a restaurant over noise, that allows you to project your voice to the back of a classroom, that allows you to spend 6 hours on the telephone if you need to, and still have a good, clear voice that people can understand at the end of your working day.
About 10 weeks after operation, I was able to spend some time with my singing group, my quartet. They felt that joy with me when I was able to put my voice back in. It was my true voice. I felt like they'd really gone through this whole thing with me. It had been about 2 years of vocal issues.
If you're on the road somewhere across the nation or even out of the country, we do have a network of laryngologists and speech pathologists that specialize in voice, and it is important to have those specialists working with you that we're happy to refer you to, and we'd really love to be able to connect our people with, our patients with, to make sure that you're working with folks who are very familiar with your specific kind of voice issues.
For me to have that opportunity to finally put my voice back, and after almost 2 years of frustration for not only me but for those guys as well, it was a wonderful day. It was a great experience.